Casey is back. She is in the house, and I want to talk about how to choose a direct primary care clinic for your company in Albuquerque, New Mexico. So that was really fast.
That was fast. What?
So now in Albuquerque, what is there? 3, probably?
Oh, gosh. I think there's about 5.
5 direct primary cares?
I think so.
So
last count.
Why should we choose Welllife then?
Because we're
I mean,
the
it's you,
best.
but I mean, everybody says they're the best.
Because we're on this podcast.
Yeah, exactly. No, I mean, like when you're looking at direct primary care in and of itself, we'll get into that. I was just teasing you with the...
Yeah, so the question is why choose us? So as an individual, we have great providers. We offer a lot of different services. I like to joke that maybe it's not a joke, that we put the health back into healthcare. And we really look at somebody from a holistic perspective. So we bring some integrative medicine. We talk about lifestyle, nutrition, and supplements, and we have the education to back it up. So some providers don't have that. They're very traditional medicine. So I guess it would depend on what you're looking for. I mean, if you just want the pill for the ill, we're not the clinic.
Yeah. So, and you know, and there's a lot of those out there, but when you're looking for a primary care clinic for your company.
Yeah. For your company. So I think we have the most experience with companies. We use a system that's designed for that. So our invoices are really slick. It doesn't share patient information. We're actually participating in a really large project that's, 3,000 employees, and it's out of Oklahoma City. It's Life Church. I'm allowed to say that. And they have like...
Yeah, they have a church in Rio Rancho, I think.
Yes, they have like 500 employees just in their headquarters in Oklahoma City. And so we're participating in the small piece of the 30 employees here in Rio Rancho. So we're not only able to handle a company of any size, unlike other clinics, we really focus on the company piece of direct primary care. We think that's so valuable. It could really save like the American dream. I mean, there's a book about that in direct primary care about how if you can reduce costs of healthcare, that money can go back to your employees, go back to your company. And so I really believe in that. There's a lot of passion for me around that.
Yeah, I know. I mean, side note, Life Church, their pastor, the pastor of all of the satellites.
I didn't even talk to you about this beforehand. But
Yeah. No, but I follow his leadership podcast because he has a really, really good. It's like he doesn't go religious at all. But you know, I mean, of course, if you have that many satellites, you basically have a ton of little independent churches all over the United States.
Yeah.
With all these employees and volunteers, which is hard to manage volunteers.
Yeah.
And then you have to be the leader of all that and make sure everything's systematically playing out the same way in all these. It's almost like a franchise type thing. So, you know, you have to be a really, really good leader. But let's use it. I want to kind of use them as an example because this is interesting if you're allowed to.
They're.
Did they search for direct primary care?
I don't really know the history of how they started, how they found out about it, but they are going all in the way a company should. This is a way a company can really benefit from direct primary care. They're a huge company. They're self-funded, completely self-funded. They are paying 100% of the membership fees for their employees. They're covering labs. They're covering radiology. They're covering everything. And they're still going to save money because they're doing it right. And so the employees have like almost no out-of-pocket costs when it comes to their primary health care. If they went to the ER, they probably have some deductibles and stuff. But for the primary routine healthcare stuff, they have like no out-of-pocket costs. So there's no barriers to their employees getting great healthcare.
So they can go on there. And then we had talked about this, and I encourage people to look at our previous episodes here on YouTube. But kind of some of the things that I think we need to step back and what is a DPC provider? Let's go right there. Because that's a really basic question. But people are like, well, why do I need DPC over already have insurance?
Yeah, so when I go around town, I talk to different business owners about direct primary care. They kind of look at me like I'm just this little person with my little clinic in little Albuquerque. And direct primary care is huge. It's a grassroots revolution that's occurring quietly in your city. And you may have heard of, that was actually one of my objections with one person was like, well, why haven't I ever heard of this? It's like, well, you're hearing about it now. And so it's big and it's quietly happening. And some huge problems are fixed from the top down, and some huge problems are fixed from the bottom up. And the top down's not working for fixing healthcare. And so I truly believe, and most direct primary cares believe that direct primary care will save healthcare from the bottom up. It'll force changes within the healthcare. Because
you're going to have people that are going to switch over?
Yeah, I mean, providers like me, I don't even know how I could go back to the traditional system. I'm unemployable.
Well, it would be, you would almost view it as probably unethical.
Yeah. How can I take care of somebody in 5-6 minutes
of
FaceTime. I simply cannot. I can barely get through a 30-minute visit and talk about everything I want to talk about, with a patient, like truly. And so once a provider sees the light, there's no going back.
Yeah. And I want, employers to understand this. It's not just this inexpensive direct primary care. You pay monthly and you're good to go. Your employees, this is like a wellness. So it's more than, it's like looking out after their health.
Right. So I don't want to use the word wellness because that's kind of a 4-letter word in the corporate environment, because there was in the 80s and 90s, there were these wellness programs.
Oh, right. Yeah.
And like
they
basically changed nothing and just charged a bunch of money, and employees actually weren't any healthier because they weren't actually providing them much health care. They were like, oh, you have high cholesterol, go see your primary care provider.
Right.
Well, the patient's not going to go see their primary care provider. They don't have a primary care provider. Direct primary care is an actual primary care provider in your town with a clinic, with a provider ready to see your employees.
And they
all the way from beginning to end.
So let's get into some of the benefits of this, because I think this is really important. What is the difference between primary care and direct primary care, like as far as benefits?
So primary care is just what you're probably used to. It's the fee for service. You make the appointment with your doctor. You get in, if you're lucky, 6 weeks from now. If you're unlucky, 6 to 9 months from now.
Right.
And
that's what's happening now.
So you wait, you go, you check in, you sit for 30 minutes, and they move you to another room, and you sit for another 30 minutes. And then the provider whooshes in, and you get 4 to 5 minutes. You get one problem, and they whoosh back out, and their MA comes in and says, okay, here's a prescription, and here's this, and have a nice day. And yeah, hopefully you don't have any questions. Hopefully you don't have any follow-up questions, because good luck getting a hold of that provider again. And it's not really the provider's fault. It's just they're so busy. They can't take good care of their patients the way they probably want to. Because
the insurance company, and we, like I said, we have episodes on this on your YouTube channel, Wildlife ABQ YouTube. The insurance company, just to do primary care, it's not beneficial to them, right? Cost-wise, or?
Oh, yeah, we're the redheaded stepchildren of healthcare. And in my opinion, because I love primary care, I love being in people's messy lives, I think we are the most valuable piece in healthcare. We are where healthcare should be accessed. We know the patient. We can keep them well. Of course, they have to be invested in being
Stop
well
eating
too.
Doritos
but we have the tools. We can keep them out of hospitals. We have the skills, but we just need to be given the abilities. But anyway, back to your initial question. I'm talking like a politician, but because I'm not answering your questions. But so primary care is like the fee for service. You walk in and they get reimbursed a little bit, and they rush in and they rush out because they make no money, so they have to see a patient every 15 minutes. And if somebody no-shows, they've lost that time slot. So they're double booking, sometimes triple booking. They don't save same-day sick appointments because they can't have a gap in the schedule.
No.
That won't keep the lights on. Whereas direct primary care, it's a very stable financial environment. Like, well, we shouldn't talk about finances in medicine, but we really need to. And so because of that, we're not having to double book. We're not freaking out if somebody doesn't fill that same-day sick slot that we keep for our members. It's not the end of the world. It's fine to have that slot. If it fills, great. If it doesn't, that's okay too.
Yeah, and some of the benefits for the for the employee, you guys have same day appointments, next day appointments.
Always reserved.
24/7
telemedicine with
with
an actual doctor who can prescribe in our state.
Yeah, see, that's crazy. Yeah, and
it's
then
not a nurse line.
And I've talked about this. I always text Jamie all the time. So, and she's my provider. So it's easy. You just text.
Yeah.
And then stuff happens. And then next thing you know, there's a prescription waiting.
Yeah. Sometimes texts get a little crazy, and then somebody picks up the phone and says, all right, let's have the discussion. And,
right.
But
it's real easy that way.
Come in, we need to see you. Like, I really need to see that rash or whatever.
Yeah, exactly.
It is, so.
Let me send a picture.
Yeah. Well, no, we've actually done a lot of rashes with a picture.
That's funny. Yeah.
That can get us started. Yeah.
That's interesting. So so you have that. Like we had said before, there's hardly no one in the waiting room. You're not waiting when you go in there.
So your employee doesn't have to take half a day off work just to go see the doctor.
Right.
They can kind of time it. They'll be like, okay, my appointment's at 2:00. I'll be out by 2:30, 2:45 because it's a longer appointment.
Right.
And I'll be back to work by 3:15. Like, it's not this, well, if they're an hour behind, I don't know when I'm going to get back. And
yeah. And then which are considered primary care providers?
Nurse practitioners, doctors that did family practice. Those are usually internists. We'll see people on a primary care. Primary care is just considered people that they're kind of the entry to the healthcare system, or they should be.
Right.
Yeah, they're specialists in primary care.
But there's not, like, when you look at primary care providers, there's no difference between direct primary care providers. Nope. It's not a separate program, or it's not less than.
Primary care is primary care. Direct primary care is how we deliver.
Right. But care. I mean, they're nurse practitioners, physician assistants, doctors.
All the same. That's all the same. It's just how you're going to receive that primary care.
It's not like it's like a degree somewhere that's a direct primary care. And there's no
direct primary care residency.
Are those what's those like model. Quack schools or whatever? It's like it's none of that.
No.
This is actually like you went to
real life
college.
Care,
you got your
all the
medications,
nurse practitioner, everything you need.
Was in the military doing that.
Yep.
Even that's cool. So, what are the qualities of an excellent direct primary care provider?
What are the qualities of an excellent direct? Well, if they're truly doing good direct primary care, all of the clinics are excellent if they're doing it right.
So, because I think this is really important. So, if I sign up as an employer, how happy is my employee going to be after they have their first visit with you?
If they're doing it right, the employee completes our online enrollment, puts in their health history. Within a day or two, they're getting a phone call. The way we set it up is we're pretty technology, like we like technology. So they get an immediate email with a link on how to schedule. If we don't see them scheduled within a few days, we give them a call. So usually they're in our clinic within a week or two as a new patient. A typical clinic is months for a new patient.
So once they sign up, you guys are usually having the first visit?
Yeah, we won't sign up a company if we don't have slots. They have to wait because we are committed to providing the care that they're expecting. So the employee gets in, they get a new patient appointment is an hour to an hour and 15 minutes, depends on how long they need, how many problems they have, what they need to talk about. Treatment plans developed, whatever refills they need, labs are ordered, whatever they need. And
they have time to be able to, it's not the 10-15 visit. This is an hour-long visit in this situation.
This one's longer for new patients. There's
that's
more
crazy.
Time allotted, of course,
That's what
there's a lot to go over.
I know, but that's so interesting to me that, I would know that my employees are getting their primary care taking, and then it's not because we can look at costs and be like, oh, that's inexpensive. Oh, that would work. But the program is what, for me, I'm always like, it's only that much. Yeah. Why aren't you charging more? We get
that all the time. It's like,
what's the catch?
How can it be so cheap? Yeah. What's the catch? Well, the truth is primary healthcare, routine healthcare is not that, it's not expensive. It's not that expensive. And we're still doing better than an insurance-based clinic and charging $75 a month.
So what happens if I have an employee, they're 55, they have to take, diabetes medicine, and I know they were going to the primary care and they were getting their medicine. How does that go down? Like, are they going to save money?
Probably. Depends on what they're taking. There's a lot of variables, but for the most part, first we try to keep patients under our roof. So a typical clinic, they're so busy, they're so swamped. They're like, okay, you've got a thyroid problem, off to the endocrinologist you go. Like, we are not going to deal with that because we don't have time to deal with that. Because we have so much more time, we try to keep everybody in our little
I see what you're saying.
Under our little roof. So that saves money because we're not sending them off. Like, we're not like, oh, go get that mole removed with the dermatologist that you have to wait 6 months for. We actually just remove it for you and have a nice
right then
day.
And there.
Yeah. It's well within our scope of practice as primary care providers to
do
that stuff.
If you're a CEO and you have employees with lots of moles, then you need to sign up.
You need to sign up right away. Yeah.
If you're tired of looking at those,
Jamie,
we can get those done.
Jamie froze like so many moles on a patient the other day. Like, she ran out of liquid nitrogen. Like, we had to order another can. But that's just crazy. Part of it. We just take care of that stuff. We want to keep you in our little bubble. We call it sending you out to the jungle. If we have to send you out to a specialist, we're like, oh.
But I mean, you guys do a lot of stuff besides that, and that's why I encourage people to go on YouTube, because if you're if you're CEO, CFO, whatever it may be, and you're probably going to a clinic to get hormone treatments and stuff like that, doing lots of blood draws, and not only is that for your employee, but it's for you too.
Yeah. So we look at what services can we provide to best service the patients that come see us. So hormone replacement is a common thing. Joint pain is a common thing. So we do special joint injections. We do hormone replacement, mole removal, things that we see often. We are taking care of within the office. We have supplements. We understand our supplements.
You have a infusion clinic.
We also have an infusion clinic if we think they'll benefit from. That's kind of a separate deal, but
Right.
We do have some cross referrals if you want to get a little boost on your nutrition, like right off the bat,
Right.
try this out. And it's not a pushy upsell environment. Our core being is the relationship of that membership, and all the other services we provide are to service that core.
Yeah, and it's really cool. I mean, you get your blood test done. You guys spent like
blood.
45 minutes, an hour with me. I knew I was down in vitamin B. So, okay, well, do you need to take some vitamin B, Jason? Yeah. Okay, here we're at. You know, I mean, we know with this issue with COVID and vitamin D.
Yeah.
You know, and so many people are deficient.
Right. So do you want a vitamin D injection today? Do you want to take them home with some pills? Which would you want to do both?
Right.
So we try to keep services that hover around
all
that
in-house,
core.
yeah. So if they want to sign up, how would they do that? And I know a business is a little bit different. Individual, they can go online, sign up, super simple, wellifeabq.com.
Yeah.
But if it's in somebody and they have 5 employees or they have 500,
right?
You know, because you're dealing with one with 3,000. What's the best way?
The best way is for a company is to set up a meeting. We have a link on our website under the employers tab that just basically sets up a meeting with me or Sasha, my office manager, and we just meet, because every company, whether you have 5 employees or 25 or 3 or 200, your needs are a little different. The way your benefits are already structured are different. Things are just different, and everybody's a little different, and your goals are different. And so we talk about that. And most of the time our puzzle piece fits with your puzzle piece, but not always.
Right.
I'd say 99% of the time we're a good fit, but sometimes we're not. And so we figure out how that's all going to fit in. And the model's really simple. $75 a month per employee per month. You know, that is unlimited.
And if they have a
primary healthcare.
wife
If
or
they have
kids.
a wife, it's $30. And usually the employee pays for the
Right.
spouse, which would be a typical way a
Right.
benefit would be structured. But they come on, they just sit with us. We sit down and say, what are you trying to accomplish? And this is how this should happen. But usually there's 1,000 questions. Super simple model.
Yes.
1,000 questions.
So best way to get a hold of you if they want to have that conversation?
You can schedule with a online meeting thing, which must be farther down, but or you can just email me, which is probably easier, is just a KC, like the Sunshine Band, so just the initials KC at welllifeabq.com.
And there it is there,
There
the
it is.
schedule
There.
of
I
business
knew it was there
review.
somewhere.
So, yeah. So, it beats.
Like a heart.
Yeah. Oh, that's awesome. Cool. So it's Casey at welllifeabq.com is the email. If you're human resources or you're a business owner, CEO, CFO, any of those, and you want more information, she'd be more than happy to have a conversation with you.
Yep.
Cool. Thanks.